Hello, I'm Tamara Pope, Vice President, Marketing and Communications at Hamilton Health Sciences Foundation. As our Innovations in Vital Care series continues, we hope that you are enjoying hearing from some of the experts at Hamilton Health Sciences. For this week's episode, our focus turns to the process of aging. As people grow into their senior years, they become more susceptible to frailty and associated health concerns. Dr. Alexandra Papaioannou is a geriatrician and Executive Director of the GERAS Centre for Aging Research. Today, she'll be speaking about how research at GERAS is focused on maximizing the resilience of vulnerable older adults. For today's episode of Innovations in Vital Care, it's my pleasure to introduce Dr. Alexandra Papaioannou.
Thank you for joining me today. I'm delighted to present to you research in aging at Hamilton Health Sciences. My role at the GERAS Centre for Aging Research is as the Executive Director. I develop and execute short and long-term strategic direction. I support and mentor our trainees from a number of faculties at McMaster University, and we communicate between the center, our executive advisors, and donors and hospital administration, and that's some of the tasks that I do as at the GERAS Centre. As well, I'm a professor at McMaster University in the Department of Medicine, and I'm a practicing geriatrician at Hamilton Health Sciences. So what is GERAS? And GERAS is the Center for Aging Research. Our mission is making lives better for older adults by bringing the best research to the front lines of care as quickly as possible. There's often a delay of between 10 to 15 years between when research actually makes a difference to patients' lives. Our research focus is in innovation in the geriatric 5 M's, which is mind, mobility, medications, multi-complexity, and built on the framework of what matters most for older adults. The Canadian Geriatric Society has made this their mission, and we're proud that we really, as a center with many geriatricians from the region, that we're focused on what matters most. So what are our research initiatives? We have many. I'm just going to highlight some of them for you today. The one that's really exciting and has had a great following, especially in our social media, is GERAS Dance, for dancing for cognition and exercise. It's a therapeutic program designed with geriatric and rehab medicine experts to improve mind, body, and health. We've partnered with the Y on this program, and with COVID, we've had to temporarily stop. We're going online, but we hope to be back at the Y soon, and with the goal of this program extending across Canada. Another very important program that we're very excited about is GERAS Frailty Rehab, which is really maximizing mobility and independence. Again, what matters most to seniors. This rehabilitation program is designed to reduce frailty and improve function in older adults who are 65 and are frail. To address the impact of COVID, we have adapted our model to deliver this remotely to ensure that vulnerable seniors stay home and are able to function and not end up in our hospitals. Another important program is GERAS Fit Joints. We are delighted to partner with the orthopedic surgeons and the program to look at getting older adults who are high risk for complications, longer stays, and discharged to assisted living or nursing homes following a joint replacement. We've developed a customized program for frail older adults that shows getting fit before surgery may reduce complications, less pain, and improve mobility after surgery. So what is the role of the hospital system here at Hamilton Health Sciences and Research? We're an excellent training environment for medical students, nursing, rehabilitation science, occupational therapists, physiotherapists. We're the largest network of geriatricians and geriatric psychiatrists with meaningful connections to older adults. And there's been over 35,000 older adults that have benefited from our research. What's very exciting is that Hamilton is one of the fastest growing populations in Canada. We have a strong mix, having major healthcare centers such as Hamilton Health Sciences, academics, McMaster University, startup technology, and our social services being very collaborative in our region. And so this is an exciting place to do research. What is frailty? I've been using that word a number of times. It's a state of diminished energy, physical ability, and cognition, to the extent that function is reduced. So this is the person that you see walking slowly, struggling to get out of the chair. There's not enough gas in the tank. So you develop pneumonia, you develop a urinary tract infection, or a doctor prescribes a couple of new medications. All of a sudden, that individual ends up in hospital with a fall. So developing frailty often leads to a spiral of consequences, including falls, loss of independence, nursing home admission, hospitalization, and death. We really need to know what are the best interventions, and there's a lot of research that our team is looking at. And what is the dose that you need to do? How frequently do you need to do it? And what is the best way to prevent individuals from ending up in hospital? So some of our studies include a number of these interventions. Exercise, what's the right amount? What type of exercise? We know increasingly that you need to do balance training and resistance training to prevent falls. And just doing resistance and balance training for 180 minutes a week reduces falls by 20%. That could really save enormous pressure from in our hospital systems. In Ontario, every 5 to 10 minutes, somebody ends up in the emergency room due to a fall. Nutrition, really key. Protein, vitamin D, the right amount, that's the kind of research we're looking at. We know increasingly that social networks are very important for both our mental and physical health. And medications, as physicians, we prescribe them, but we really want to ensure that they're the right medication and they don't have side effects or interact with other drugs we're taking. As well, we're studying which over-the-counter medications can impact on frailty. And there's a number of misconceptions about frailty. When we see that older adult who's walking slowly, a little bit of curved back, difficulty getting out of the chair, we think that it's not reversible, but in fact, it can be reversed by the interventions that I mentioned. And the other very important research that we're looking at, when should you start doing these kind of interventions? At what age? Is it too late to do it in your 80s? Our research is showing it's never too late. The other area that we're really focused in, and we're really proud of at Hamilton Health Sciences and at the GERAS Centre, is we're looking at innovations in care and disease prevention. And one of our, this picture highlights our partnership with the Center for Aging and Brain Health Innovation and a company called Darmian in California, where we've looked at what predicts if somebody has some mild memory changes, what converts, what causes them to switch to Alzheimer, who is that individual going to be, and who should look at other innovations, medications, or other therapies. So we're really excited about those kind of opportunities. We brought a number of these technologies to Hamilton Health Sciences, and our frontline workers have been invaluable in giving feedback in the development to both companies and our group, the scientists at the GERAS Centre. Some are innovations in the pipeline that the foundation has been very generous in their support. A number of the projects I've mentioned, the foundation has supported, but one of the exciting ones is called the Fit Frailty app, which can be used to assess, are you at risk of frailty? We can look at how fast you walk. Are you having difficulty getting out of the chair? And these are all interventions that we can target after we know where you stand. Internationally, we've developed some tools that are throughout the world in nursing homes that tell us who's at risk of breaking their bone. And that's really important because that's actually one of the major causes people get transferred to acute care due to a hip fracture. And residents in long-term care have told us that the one thing they want is they don't want to break their hip due to the pain and being transferred to the hospital. So our tool is able to really look at why older adults fall and who will break their bone. So that's just a really a whirlwind of some of the exciting work we're doing here at the GERAS Centre with our clinical scientists. We'd like to thank the Hamilton Health Sciences Foundation for their support and their ongoing inspiration to the center. So thank you very much for joining us today.
Well, thank you, Dr. Papaioannou. And I must say, I had the pleasure of attending a GERAS dance session, and it was interesting hearing you speak about the importance of socialization as well as exercise in managing frailty. And it was amazing to see how people just lit up, and there was so much laughter and joy at the GERAS Dance Center. And I just wanted to let you know it was so inspiring to see. It was wonderful.
That's wonderful. I know from our patients, they continue to ask me, husbands, wives, when can we go back? And people have made long-lasting friendships. And so we know health and healthcare, that really is inspiring for us.
Wonderful. And something else you touched on is the fact that a lot of the research results from the research projects being conducted at GERAS, they impact patients not only at St. Peter's Hospital or Hamilton Health Sciences, but they have an international impact as well.
Thanks, Aaron, for bringing that up. Is you know, because we're scientists, we publish in international journals. We did present prior to COVID at international meetings and continue to present now online. But what we're really most proud of is that our research is actually making a difference in people's lives, that it's being used internationally.
And donor support is so important to research at Hamilton Health Sciences in general. If you could convey a message to donors who might be watching this video, what would you tell them?
You know, we really appreciate your donations. Without those kind of donations, research really would not be possible, the type of research that we're doing. It is really critical that we continue to support research at Hamilton Health Sciences. Not only does it impact on our patients' lives, but it really is so important for the staff to engage in improving the quality of their lives of their patients. And research is one of the ways that they're getting the best possible evidence and making a difference.
And for you personally, what's the most fulfilling part of the work that you do?
You know, the most fulfilling part of the work I do, Aaron, is, of course, it's exciting to see your article published and, you know, being, another publication, another grant. But what's really exciting is when I sit in the clinic and patients tell me, you know, doctor, thank you for making a difference in my wife or my husband's or my parents' life. And the research that you do makes a difference.
Well, thank you, Dr. Papaioannou. That was very interesting. Thank you for joining us today.
And thank you, Aaron, for this wonderful opportunity of sharing what are the donations that donors are giving to Hamilton Health Sciences, how they're impacting on our patients' lives. So especially seniors. So thanks again.